Every year, millions of older adults begin to notice small changes that are easy to explain away. A name that used to come instantly now takes a little longer. A set of keys disappears 3 times in 1 week. A familiar street suddenly feels confusing for a few seconds. And when these things happen, most people tell themselves the same thing. I guess this is just part of getting older, but what if it isn't? What if one of the biggest threats to your memory is sitting in your medicine cabinet right now? Before we begin, I'd like to ask you one simple question. How old are you, and how many prescription medications do you take every day? Let me know in the comments below. I read as many of your comments as I can, and your experiences often inspire future videos that help thousands of other families. And if you believe more people deserve to learn how to protect their memory as they age, please take a second to like this video and share it with someone you care about. It may help them ask an important question before it's too late. Over the years, I have seen people who were sharp, independent, and full of energy slowly begin to lose their confidence. They forgot appointments, repeated the same stories, or struggled to remember familiar places. Everyone assumed it was simply aging. But sometimes the real cause was something completely unexpected. It was not Alzheimer's disease. It was not their family history. It was the medications they had been taking every single day. Many of these medicines are incredibly common. Some are used for heartburn. Others help with allergies, sleep, anxiety, bladder problems, or high cholesterol. A few are even sold over the counter, leading many people to believe they couldn't possibly affect the brain. Today, we're counting down 7 common medications that may be linked to memory problems in older adults. And be sure to stay until the end, because the number one cause isn't a single medication at all. It's a hidden combination that millions of people unknowingly live with every day. This video is not about stopping your medications on your own. It's about knowing the right questions to ask your doctor, recognizing the warning signs early, and giving your brain the best chance to stay healthy for years to come. Let's begin with number 7. Now, let's begin with number 7. Many people are surprised that the first medication on this list isn't for the brain at all. It's for the stomach. Proton pump inhibitors, often called PPIs, are commonly prescribed to treat heartburn, acid reflux, and stomach ulcers. Medications like omeprazole and esomeprazole have helped millions of people find relief from painful digestive problems. For many, they become part of a daily routine for years without a second thought. The problem is that your stomach acid does more than digest food. It also helps your body absorb important nutrients, especially vitamin B12, which plays a critical role in keeping your nerves and brain healthy. When stomach acid stays too low for a long time, your body may absorb less vitamin B12 over months or even years. That deficiency can contribute to fatigue, poor concentration, tingling in the hands and feet, and memory problems that are often mistaken for normal aging. Researchers have also explored whether long-term use of these medications may be associated with changes in cognitive health. While the evidence is still evolving and not every study reaches the same conclusion, many healthcare providers agree that proton pump inhibitors should be used at the lowest effective dose and only for as long as they are truly needed. If you've been taking one of these medications every day for several years, don't stop it on your own. Instead, ask your doctor whether it's still necessary, whether your vitamin B12 level should be checked, or whether a different treatment plan might be appropriate. Now let's move to number 6. And this one may be sitting in your home right now without a prescription. Older antihistamines, especially diphenhydramine, are found in many allergy medications and nighttime sleep aids. Because you can buy them off the shelf, many people assume they are completely harmless, but inside the brain, they work very differently. These medications block acetylcholine, a chemical messenger your brain depends on to form new memories and stay mentally alert. As we grow older, our brains naturally produce less acetylcholine, making every remaining signal even more valuable. That means a medication that causes only mild drowsiness in a younger adult can leave an older person feeling confused, forgetful, or mentally sluggish the next morning. Some people describe it as walking through a fog. Others simply notice they are forgetting little things more often than they used to. If you regularly take an over-the-counter sleep aid or allergy medicine, take a moment to read the active ingredients. You may be surprised to discover that the medication you trust most is one your doctor would recommend avoiding for long-term use as you age. And the next medication on our list is even more surprising because millions of people take it every morning to protect their hearts, never realizing that for some individuals, it may also deserve a conversation about brain health. Now, let's continue with number 5. If your doctor has ever told you that your cholesterol was too high, there's a good chance you've heard of medications called statins. Drugs such as atorvastatin and simvastatin have helped reduce the risk of heart attacks and strokes for millions of people around the world. For many older adults, these medications are life-saving, and they remain an important part of treatment when prescribed appropriately. So why are they on this list? The answer is not because statins are dangerous for everyone. It's because some people report changes in memory or mental clarity after starting certain statins, and researchers have been trying to understand why. Your brain contains a large amount of cholesterol, which plays an important role in maintaining healthy nerve cells and allowing them to communicate efficiently. Some statins are more likely than others to enter brain tissue, and in certain individuals, that may contribute to temporary memory complaints or difficulty concentrating. Fortunately, these symptoms are not common, and many people take statins for years without experiencing any cognitive problems at all. If you've noticed forgetfulness or brain fog after beginning a cholesterol medication, don't assume you have to choose between protecting your heart and protecting your brain. Your physician may recommend adjusting the dose or switching to a different statin that is less likely to affect the central nervous system. The important message is simple. Never stop taking a cholesterol medication without medical advice, especially if it was prescribed to reduce your risk of heart attack or stroke. Now let's move to number 4. For many older adults, bladder urgency can become one of the most frustrating parts of aging. The constant need to find a restroom can interrupt sleep, limit travel, and make even simple outings stressful. That's why medications such as oxybutynin are so commonly prescribed. Unfortunately, the same mechanism that helps relax the bladder can also affect the brain. Like several other medications on this countdown, oxybutynin blocks acetylcholine, the chemical messenger that helps create new memories and supports clear thinking. In younger adults, the effect may be barely noticeable, but in older adults, whose brains already produce less acetylcholine, the impact can become much more significant over time. Some people begin forgetting appointments. Others lose track of conversations or struggle to find the right words. Because these changes usually develop gradually, they are often blamed on aging instead of the medication itself. If you or someone you love takes medication for an overactive bladder and has noticed increasing memory problems, it's worth having an honest conversation with the prescribing doctor. Today, there are newer treatment options that work through different pathways and may have a lower risk of affecting cognitive function. The right medication should improve your quality of life, not quietly take away your mental sharpness. And coming up next is a group of medications that millions of people rely on to calm anxiety or help them sleep. They may bring relief tonight, but over time, they could carry a hidden cost that many people never see coming. Now we're entering the top 3, and this next category deserves your full attention because millions of older adults take these medications every single night. Benzodiazepines include well-known medications such as Xanax, Ativan, and Valium. They are commonly prescribed to relieve anxiety, calm panic attacks, and help people fall asleep. For someone who has spent weeks lying awake at night or struggling with overwhelming anxiety, these medications can feel like a lifeline, and in many situations, they serve an important medical purpose. The concern begins when they remain part of a person's routine for months or even years. These medications work by slowing activity throughout the brain. That calming effect may help you sleep, but it can also reduce alertness, slow reaction time, and make it harder for the brain to form and store new memories. The longer they are used, the greater the chance that these effects become noticeable, especially in older adults. Many families describe the changes in similar ways. A loved one starts asking the same question twice during a conversation. They forget why they walked into a room. They struggle to follow complex discussions that once felt effortless. At first, everyone assumes stress or aging is to blame. Few people stop to consider that a medication intended to provide comfort could also be contributing to the problem. Another challenge is that the body processes these medications more slowly with age. Instead of leaving the system overnight, the drug may remain active well into the following day. That lingering effect can increase daytime drowsiness, reduce balance, and raise the risk of falls, which are already a major health concern for older adults. One of the most important things to remember is that benzodiazepines should never be stopped suddenly after long-term use. Doing so can trigger severe withdrawal symptoms and, in some cases, serious medical complications. If you believe your medication is affecting your thinking or memory, the safest approach is to speak with your healthcare provider about a gradual tapering plan and possible alternatives that better fit your current needs. Sometimes, improving sleep habits, addressing underlying anxiety through counseling, or switching to another treatment can provide lasting relief with fewer effects on memory. Every person's situation is different, which is why individualized medical guidance is so important. Now we've reached number 2, and this medication surprises even many healthcare professionals because it belongs to a group of drugs that most people consider relatively safe. Yet one particular member of that group stands apart for a reason that could make a real difference to your long-term brain health. We finally reached number 2, and this medication often catches people completely off guard. When most people hear the words antidepressant or anti-anxiety medication, they assume every drug in that category works the same way. But that's not true. One medication, paroxetine, has characteristics that make it different from many of the other antidepressants doctors prescribe today. For millions of people, antidepressants have been life-changing. They have helped individuals recover from depression, regain hope, and manage anxiety that once made everyday life feel overwhelming. Mental health is just as important as physical health, and for many patients, these medications provide benefits that far outweigh their risks. However, as we get older, the choice of which antidepressant to use becomes increasingly important. Unlike many newer antidepressants, paroxetine has a stronger anticholinergic effect. That means it can interfere with acetylcholine, the same brain chemical we've mentioned several times throughout this countdown. Acetylcholine plays a vital role in learning, attention, and the formation of new memories. When that system is disrupted, some older adults may begin to notice subtle but meaningful changes in their thinking. At first, the signs can be easy to dismiss. Maybe it takes longer to remember someone's name. Perhaps reading a book requires more concentration than it used to. You might find yourself walking into a room and forgetting why you went there. On their own, these moments may not seem unusual, but when they become more frequent, it's worth taking a closer look. That doesn't mean paroxetine is the wrong medication for everyone. For some patients, it may still be the most appropriate choice based on their medical history and overall health. The important point is that there are several antidepressants available today, and some have a lower potential to affect memory and cognitive function in older adults. If you're taking paroxetine and have concerns about your memory, don't stop the medication on your own. Suddenly discontinuing an antidepressant can lead to uncomfortable withdrawal symptoms and may cause depression or anxiety to return. Instead, schedule a conversation with your healthcare provider. Together, you can review your symptoms and decide whether another medication might better support both your emotional well-being and your long-term brain health. That brings us to the final and most important item on today's countdown. Surprisingly, it isn't a single medication at all. It's a hidden problem that can develop slowly over the years, affecting people who are simply taking several common medications exactly as they were prescribed. We've reached the number 1 spot, but here's the biggest surprise of today's countdown. The greatest threat to your memory may not be a single medication. It may be the combination of several medications that seem completely harmless when taken one at a time. This hidden problem is known as the anticholinergic burden, and many experts believe it deserves far more attention than it receives today. Think about a typical older adult. They take one medication for allergies during the spring, another to help them sleep at night, one more for an overactive bladder, perhaps another for depression or chronic pain. Each prescription was written for a good reason. Each medication may be appropriate on its own, but when several of them share the same effect on the brain, their impact can begin to add up. Imagine trying to have a conversation in a room where someone slowly dims the lights, one switch at a time. At first, you barely notice the difference. Then, reading becomes more difficult. Faces become harder to recognize. Eventually, the room feels so dark that even familiar objects become difficult to see. The same thing can happen inside the brain. Every medication with anticholinergic activity slightly reduces the brain's ability to use acetylcholine, one of its most important chemical messengers. When several of these medications are taken together for months or years, the brain has to work much harder to perform tasks that once felt effortless. That is why some older adults begin forgetting appointments, repeating stories, misplacing everyday items, or feeling mentally exhausted. After simple conversations, families often assume these changes are an unavoidable part of aging, when in reality, the medications themselves may be playing a significant role. The encouraging news is that medication-related cognitive problems can sometimes improve when they are recognized early and addressed appropriately. In some cases, reviewing medications with a healthcare professional, reducing unnecessary drugs, or choosing safer alternatives may help restore mental clarity over time. Of course, every situation is different, and any changes should always be made under medical supervision. So here's a challenge for you. Within the next week, make a complete list of everything you take. Include your prescription medications, over-the-counter products, vitamins, herbal supplements, and even the sleep aids you only use occasionally. Then bring that list to your doctor or pharmacist and ask one simple question: are any of these medications affecting my memory, and are there safer alternatives for someone my age? That single conversation could become one of the most important investments you ever make in your long-term brain health. Because protecting your memory isn't only about finding the right medication. Sometimes it's about discovering which medications you may no longer need. Today, we've covered 7 common types of medications that may affect memory as we grow older. Before we finish, I'd like to share one personal thought. In my opinion, one of the biggest mistakes we can make is assuming that every memory problem is simply part of aging. Sometimes it is, sometimes it isn't. The important thing is recognizing that certain medications may also play a role, and that asking the right questions early could make a meaningful difference. Medication is not the enemy. Many of the drugs we discussed today save lives and improve quality of life. The goal of this video is not to create fear, but to encourage awareness and better conversations with your healthcare provider. I also want to make one thing very clear. This video is for educational purposes only and should never replace professional medical advice. Please do not stop, change, or reduce any medication without first speaking with your doctor or pharmacist. Every person's medical situation is different, and the safest decisions are always made together with a qualified healthcare professional. Now, I'd love to hear from you. Which medication on today's list surprised you the most? Leave your answer in the comments below because your experience may help someone else. If you found this video helpful, please take a moment to like it and share it with a family member or friend over the age of 60. You could help someone recognize an important warning sign before it's too late. And don't forget to subscribe for more practical health information designed specifically for older adults. In our next video, we'll reveal several surprising physical warning signs that may appear long before serious health problems are diagnosed. You won't want to miss it. Thank you for watching. Stay informed, stay healthy, and I'll see you in the next video.